Adolescent Pregnancy, presented by Sofía Hurtado, Andrea López, and Eliana Rendón. Causes: unwanted teenage pregnancy occurs more frequently after the onset of early sexual relations. The lack of sexual education and the misuse of contraceptives. Adolescent pregnancy more dangerous the younger the future mother is. Sometimes the body of the adolescent has not finished its development. Although there are many causes of unwanted pregnancies in adolescents, here we expose the most relevant. Early start of sexual relations. Currently, more and more teenagers have sex before they turn 16. In this way, when beginning to have sexual relations at an early stage, adolescents are not prepared to assess the consequence of irresponsible sexual behavior. Lack or distortion of information about contraceptive methods. All the truthful information that the contribution will benefit them in a moment of their life in which they are so vulnerable to the advice of their peers. Incorrect use of contraceptive methods. This is due in part to the lack of information that we have discussed previously. Some adolescents ignore contraceptive methods, thinking that they can compensate using tactics such as reverse, in which they interrupt the penetration moments before ejaculating.
Prevention of pregnancy in adolescents. About 43% of adolescents aged 15 to 19 have had sex at some time. 4 out of 5, more than 4 in 5, used contraception the last time they had sex. 5%, less than 5% of adolescents who use contraception use the most effective types. What are contraceptive methods and what are they? Contraceptive methods are used to prevent pregnancy and are classified into folkloric, natural, and modern. What are folkloric methods? These are popular beliefs or practices that people had with the conviction that they help prevent pregnancy, but they are not really effective or have a scientific basis. What are modern or artificial methods? They are methods that help prevent pregnancy through non-body elements and are divided into modern temporary methods and definitive modern methods. As their names indicate, temporary methods can be discontinued at any time and fertility will return if the woman wishes to become pregnant. The definitive modern methods are surgical procedures that will permanently prevent a man or woman from having children. Modern methods are highly effective, offer 98% protection, and are classified as hormonal barrier dispositives and phenotypes. What are natural methods? Natural methods are based on the functioning of the reproductive system of men and women to prevent pregnancy. Therefore, no protection mechanism external to the body is used. For example, in the case of women, the 40 days where ovulation occurs are taken into account and there is an increased risk of pregnancy. In men, the control of ejaculation. These methods are unreliable and can put people at risk not only for an unwanted pregnancy but for sexually transmitted infections (STIs).
Consequence of teenage pregnancy. Problems during pregnancy. Pre-risky pregnancy because the body is not prepared. Premature delivery. Contrast anemia or problems in the placenta. Suffer hemorrhages and complications in childbirth. Possible complications for the baby. It is low in weight. Premature babies. They can also be born with problems or bad formations. And another possible problems. Economic and social. Do not finish the studies. Abandonment on the part of the responsible parent. Difficulties in the professional field. Adolescents are not physically or mentally prepared to have a baby and take responsibility for motherhood. So live your life before creating a life.